Well, hey, everybody, welcome back to class and welcome to module number 4, the depressants and the inhalants. And as we talked about last week, starting last week with module number 3 and the stimulants, all the way through module number 10, we're going to be talking about these different classifications and families of these different substances that I just think are really important for all of us to be familiar with. Again, as now I've said 2 or 3 times in this class, there may be some modules we go through to where you know already a lot of the information, but it doesn't fail. Every time I teach this class, I have a lot of students who say, I never really knew that. I never knew that that's what that was. I didn't know that was an example of that or whatever it may be. So some of the information may be new to you. Some of it may be reinforcing to you. Others of it may be just refreshing you what you already know. But this module is talking about the next class of substances called the depressants, and the inhalants are also included here. And so you may remember last week that one of the things I talked about was that one of the ways that we sometimes classify or organize different classes or families of substances is pharmacologically, which just means that we look at what does the substance normally do in the body to our central nervous system, to our heart rate, our respiration, and our brain function. And last week, all of the stimulants were all of those substances that naturally stimulate, speed up, our central nervous system. They increase our alertness, they increase our respiration, they increase our heart rate, our blood rate, our brain function activity. And as a result, we oftentimes feel a sense of euphoria, feel a sense of heightened awareness and alertness. Those are the stimulants. Well, not every single substance that you and I ingest and put in our body does that. There are some that do the opposite of that. Because of the way that they are created pharmacologically, just chemically, how they are created, what they do inside the body when we ingest them is the opposite. They slow down our respiration, or they slow down our heart rate, or they slow down our brain function to where it kind of soothes us and kind of calms us. It might make us feel kind of sleepy. It might even put us to sleep. Well, the stimulants don't do that. They kind of rev us up. Well, the depressants kind of bring us down because sometimes that's what we need, or sometimes that's what people are kind of looking for. So there are a number of different substances that fall into this category. Let me mention this. Alcohol is the greatest depressant of all. And we're not talking about alcohol in this section because we're going to do an entire module on alcohol. But from a pharmacological standpoint, alcohol is not a stimulant. Alcohol is a depressant. It soothes and numbs and kind of calms people. I've had people before say it's that warm blanket, right? That warm blanket that you kind of put on. Well, a stimulant is not a warm blanket. Well, the depressants are a warm blanket that you kind of put on, and when you use them, right, the natural effect oftentimes is kind of that warm blanket effect. That's oftentimes what alcohol does. Alcohol does that because pharmacologically and chemically it is a depressant. And so it is also included in this family, but we're not going to talk about alcohol in this section of depressants. We're going to talk more about the substances and the medicines that kind of fall in this category here as well too. Sometimes we call these substances the sedative hypnotics. Maybe you've heard that phrase before in other classes or your pharmacology class. The sedative hypnotics. The word sedative just means to sedate or to put someone to sleep. And you and I know that if you and I go to the hospital today for surgery and they give us anesthesia to put us to sleep, well, anesthesia is an example of a sedative. And technically a lot of the anesthetic-like drugs that doctors use today to numb us or to put us to sleep for a procedure or whatever, they also too belong to the depressant family. And what we're going to kind of highlight would be more the substances that are just more common for us for the everyday person as far as using to kind of calm our mood down or whatever it may be, but the sedative hypnotics. So I mentioned to you, kind of like I did with the stimulants, I give you an example of an old school depressant called the barbiturates. Now, maybe you've heard that phrase before, maybe you've not, but just like back in the old days with stimulants, back in the 30s and 40s and 50s, pharmacists and chemists with the stimulants were developing prescription amphetamines, and they would give them to people who were depressed or were sleepy all the time, and it kind of revved them up and kind of perked them up, and they felt a lot better. And so amphetamines oftentimes were initially used as prescription antidepressants oftentimes. And so unfortunately, people began to abuse those amphetamines. And now today we've moved away from using prescription amphetamines for that. Well, during that same period, 80 years ago, 100 years ago, there was a group of prescription medicines called the barbiturates that was developed in Europe, and they're depressants. And what people found was that when someone was agitated or was anxious and they could not sleep and they had insomnia, they could give people prescription barbiturates, and people they would take them and they'd go to sleep, or they'd take them and they stopped having a panic attack, or they would take them and they would feel less, manic or whatever if they had bipolar disorder. So the barbiturates are kind of in a way the grandfather, the grandmother, of the prescription depressants. The problem with the barbiturates is they were addictive, and people created a dependent upon them, and they then became substances of abuse, and people would get them and sell them on the street, right? And so people would become dependent upon the barbiturates, and during the 1960s and 70s and 80s, pharmacological companies, would come together and try to create new drugs, prescription drugs that weren't as addictive. And so you have the barbiturates, or what we used to call the tranquilizers. And then now today, more modern day, these pharmaceutical companies have developed what we call the minor tranquilizers and the major tranquilizers. So in this section, last week we talked about stimulants. We talked about how I gave you examples of both legal and illegal stimulants, prescription medicines, right? And then also too, like cocaine. Well, in this section, we're just going to kind of review most of the what we're going to review are going to be prescription medicines. So, for example, there are what we call the minor tranquilizers. Maybe you've heard the term benzodiazepines. So the benzodiazepines are prescription medicines that fall in this category of depressants. And probably one of the most number one prescribed type of medicine today are usually one of two benzodiazepines: medicine to help people sleep and medicine to help people feel less anxious. So lots and lots of prescriptions being written in the last 25 to 30 years in America for sleep problems and for anxiety. And a lot of those drugs like Xanax and Valium fall into what's called the benzodiazepine kind of family. We sometimes refer to them as anti-anxiety drugs. So people have tension, or they have OCD, or they have post-traumatic stress, or they have panic attacks, or whatever it may be, and they have sleep problems, they have insomnia, they can't get to sleep, they have all this stress, all this problem. There are what we call the benzodiazepines, like Valium and Xanax. Those are the two most common. Probably there are others that doctors can and do prescribe today to give to people to help them to sleep, to help them to feel less anxious, to help them to have less panic attack of symptoms, those kinds of things. We also sometimes see those anti-anxiety medicines, the minor tranquilizers, used sometimes even for depression. Through the years, I've had students before who, when I've been teaching a class like this, talking about the medicines, they'll say, you mentioned the minor tranquilizers being for the benzodiazepines being for anxiety. My doctor's prescribed one to me or some to me, and I take them for depression, and they kind of help me feel less depressed or feel less anxious and depressed. So we sometimes see a little crossover where we see sometimes people who battle depression may take these minor tranquilizers or these anti-anxiety medicines. So I give you some information in the lecture notes about the barbiturates and about the minor tranquilizers, the benzodiazepines. So go and learn a little bit about the differences between those two. And then the kind of the last class of prescription depressants or sedatives would be what we call the major tranquilizers. So you have the minor tranquilizers, which is for anxiety, and the major tranquilizers, which are more for schizophrenia and bipolar disorder. So the minor tranquilizers, benzodiazepines, more the anti-anxiety and the sleep medicines, those are minor tranquilizers. The major tranquilizers are what we sometimes call mood stabilizers. And what these are, for example, if you know a little bit about bipolar disorder, when someone's mood is manic with bipolar disorder, their mood is high and euphoric and excitable, and their mood needs to come down to be more stable. When someone battles depression, their mood needs to come up. So kind of a mood lifter, we would say, is needed for depression. But when someone has bipolar disorder, their mood is high and manic already, and they need their mood to come down. We need what we call a mood stabilizer. So the mood stabilizers are often referred to, and there are many of them, prescription mood stabilizers, Risperdal, Seroquel, some of those that are more what we call mood stabilizers. And they're used for mainly bipolar 1 disorder, where mood is often manic, and then also too for schizophrenia. We have found that these medicines also too help people who have schizophrenia, who may be delusional or hallucinating or have easy agitation, to kind of calm them down a little bit, not to put them to sleep, but to kind of calm them down a little bit with very, very few side effects oftentimes. The major tranquilizers are also kind of fall in this category as well too. So I give you some information in the lecture notes about the major tranquilizers, those mood stabilizers that we also see as well too. They fall in this category. Both the minor and the major tranquilizers are kind of prescription medication classes that we oftentimes see in mental health counseling, especially. And again, they have fewer side effects. Traditionally, they have fewer addictive potentially than some of the others. Although I did mention this a minute ago, with the minor tranquilizers, I do give you some information in your lecture notes, like Xanax, for example. There is a dependence potential, and we see that oftentimes as a prescription medication that people can sometimes abuse and become dependent upon. So all those are prescription medications that we sometimes see that fall in this category. And then there are the inhalants. I always tell this story because it's just one of the things that just reminds me, I'm always reminded of whenever I talk about the inhalants. Many years ago, I may have mentioned this in this class already. I've mentioned this in my other classes. Many years ago, when I was in graduate school, I worked for about a year and a half, almost 2 years, in a residential treatment facility with at-risk youth. That's kind of where I cut my teeth, so to speak, in working in this field. While I was in school, I worked my way through as a direct care provider, working with at-risk kids, mainly boys, but boys and girls. The unit where I worked was a co-ed unit. And so I remember that went right not long after I started working there, that one of the things that happened, if you ever work with kids, you know that kids learn from one another. And one of the things I remember, this was one of my first jobs working with kids. And one of the things that happened in this facility was every day the kids would walk across the parking lot to a couple of portable trailers where there was a classroom. And the guys would go in one trailer and had a teacher, and the girls would go in another trailer and had a teacher. Well, in that classroom, people just didn't think about it back then. There were some magic markers, like some dry erase markers that you could kind of write on. There was sort of a dry erase board in both classrooms. And a couple of girls began to discreetly try to, although they got caught eventually, at the end of the day, they would take those magic markers. They would take one or two every day and put them in. Often many of them would wear like hoodie sweatshirts, and they would hide those magic markers in their hoodie sweatshirt. They would go into their room and they would take the arm of the hooded sweatshirt, and they would take that magic marker and they would just basically coat the magic marker black, the sleeve black, and this was a magic marker that had some fumes in it, right? And then they would pull that hood up over their head and they would take and put their nose down in their elbow and they would huff that aerosol, so to speak, that magic marker chemical, as a way to get this mild kind of rush and this mild kind of high, a little bit of that. And for many days we did not know what was going on, but we could smell it. I remember we would wonder, it smelled. We'd go in the kids' rooms and it just stunk. We were like, what stinks in here, right? And these kids would not, these two or three girls especially, started with the girls and went to the guys, they would not take their hooded sweatshirts off. They always had them on. And they would roll the sleeves up to hide where they colored it black until they were by themselves. They would unroll it and they would huff it. Well, I remember that being one of my first examples of kids and some of the creative ways, not just with kids, adults too, will sometimes find to abuse a substance. And I'd never thought about that. I should have known that, but I never thought about that. And so I talk about it in this section, a class of substances that we don't think about a lot, and that's the inhalants. And usually the inhalants are tempting to kids, adults too, but especially kids who want to be secretive and discreet in their substance use and experimentation. And so oftentimes household chemicals, gasoline, dry erase markers, whatever, all kinds of just vapors and chemicals, chemicals and household products that involve chemicals and vapors, paint, for example. Through the years, in my experience in working with kids especially, inhalants are often tempting to them because they have easy access to them. They don't cost them any money usually, and they can be discreet in how they use them. And so I give you some information in the lecture notes about the inhalants. The inhalants kind of, again, pharmacologically, from a chemical standpoint, the inhalants kind of fall in this depressant category of, again, this warm blanket, right, as far as how it feels when someone huffs a chemical or an inhalant. Most often it has the pharmacological effect of slowing down, mellowing out, respiration, heart rate, central nervous system function, all of that. So the inhalants belong to the depressant category as well too. So 2 weeks in a row here, we have the stimulants last week in module number 3. We have the depressant and the inhalants in module number 4 this week. And like I said, we're going to head to talking about alcohol here eventually, and alcohol would belong in this category as well too of the depressants. So go through, after watching this video, make sure you look at the lecture notes. I give you a lot more information in the lecture notes. Make sure you do your discussion question for the week, do your homework, come back next week for Module 5. I will see you then. Talk to you then.